Our sense of sight is one of life's greatest gifts, a remarkable ability that allows us to experience the world in all its richness and wonder. Through our eyes, we take in the beauty of a sunrise, the vibrant colors of a bustling city, and the subtle expressions on the faces of those we love. Sight connects us to our surroundings in vivid color and detail, helping us interpret and understand everything from the grandest landscapes to the tiniest details of daily life. It lets us see the faces of our loved ones, share stories through books, and witness breathtaking sunsets that fill us with awe. Our vision is the bridge to shared experiences, laughter, and memories that last a lifetime. Vision is essential for navigating our environment, crossing busy streets, and appreciating the beauty of a blooming flower or a work of art. It gives us confidence and independence in our daily routines. When sight is lost, it can be devastating. The world may suddenly seem unfamiliar, and simple tasks become overwhelming. Losing vision affects not only our independence, but also our emotional well-being and sense of connection. Everyday activities like cooking, reading, or even recognizing a friend's face can become challenging. The world can feel isolating, and many people experience loneliness or frustration as a result. But there is hope. Up to 80% of blindness and vision impairment is preventable or treatable. Advances in medicine and technology mean that many eye conditions can be managed or even reversed if caught early. Conditions like cataracts, which cloud the lens of the eye, can often be corrected with a straightforward surgery, restoring clear vision and independence to millions. Other conditions, such as glaucoma or diabetic retinopathy, can be managed with early detection and proper care, preventing further vision loss and preserving sight for years to come. That's why regular eye exams are so important. They allow doctors to catch problems before vision is lost, often before any symptoms appear. Early intervention can make all the difference. By prioritizing eye health, we protect not just our vision, but our quality of life and our ability to stay connected to the people and experiences that matter most. Awareness and education are powerful tools in preventing blindness. When communities understand the importance of eye care, more people seek help early and protect their sight. Simple, proactive steps, like wearing sunglasses, using protective eyewear, managing health conditions, and using prescribed eye drops, can save someone's sight and prevent future problems. Everyone, regardless of age or whether they have symptoms, should have regular eye checkups. Children, adults, and seniors all benefit from early detection and timely treatment. Early detection transforms lives and futures, allowing people to continue learning, working, and enjoying the world around them. We have the power to prevent avoidable blindness by taking action for ourselves and encouraging others to do the same. It all starts with making eye health a priority for ourselves, our families, and our communities, because our vision truly is a precious window to our world. Prevention of Blindness Week began in India, a country where millions have struggled with vision loss for generations. The burden of blindness was not just a personal tragedy, but a challenge that touched families, communities, and the nation as a whole. For decades, high rates of vision impairment affected daily life, limiting opportunities for education and work, especially in rural and underserved areas. Many people believed blindness was simply a part of fate, something to be endured rather than prevented. In 1960, the Indian government took a bold step. Inspired by visionary leaders like Jawaharlal Nehru and Rajkumari Amrit Kaur, they recognized that blindness was not only a medical issue, but also a social and economic one. They saw that preventing blindness could transform lives and uplift entire communities. Thus, Prevention of Blindness Week was launched, observed every year from April 1st to 7th. The goal was clear: to fight preventable blindness by raising awareness, providing education, and making eye care accessible to all. Early efforts focused on tackling the most common causes of blindness: cataracts, trachoma, and vitamin A deficiency. Special attention was given to children and the elderly, who were most at risk, and to rural communities where medical resources were scarce. The campaign harnessed the power of radio, newspapers, and local gatherings to spread a new message: blindness is not inevitable. With the right knowledge and care, it can often be prevented. This was a revolutionary idea in many communities, challenging deep-rooted beliefs and offering hope to those who had long accepted vision loss as their destiny. The movement's success laid the groundwork for the National Program for Control of Blindness, which was officially launched in 1976. This marked a new era in public health, with a focus on prevention, treatment, and rehabilitation. India's early commitment to eye health proved that investing in sight is truly investing in the nation's future, empowering children to learn, adults to work, and communities to thrive with the gift of vision. Prevention of Blindness Week stands on 4 essential pillars: awareness, access, donation, and education. These pillars form the foundation of a brighter, healthier future for millions at risk of losing their sight. Each pillar represents a unique approach, but together, they create a powerful force for change. The first pillar, awareness, is about spreading knowledge far and wide. It educates people about the most common causes of blindness, such as cataracts, glaucoma, and diabetes, and highlights the early warning signs that should never be ignored. Through community talks, posters, and media, the campaign empowers people to recognize symptoms and take action. The message is clear: don't ignore symptoms like blurry vision, eye pain, or sudden changes in sight. Seek help early, because timely intervention can make all the difference. The second pillar, access, brings quality eye care directly to the people. Free or subsidized screening camps are set up in cities, towns, and remote villages, ensuring that even the most underserved communities can get their eyes checked. Early detection is key to preventing irreversible vision loss. By catching problems early, many people can avoid blindness altogether and continue to lead independent lives. The third pillar, donation, focuses on the gift of sight. The campaign encourages people to pledge their eyes for donation after death, dispelling myths and fears that often hold them back. Volunteers and doctors explain how one person's decision can transform the lives of two people suffering from corneal blindness. Eye donation is a selfless act that can restore sight and hope, giving someone a second chance to see the world and their loved ones. The fourth pillar, education, is about long-term prevention. It teaches children the importance of nutrition for healthy eyes, guides adults on managing diabetes and hypertension, and reminds everyone about the value of eye safety at work and at home. Community outreach programs help families adopt good eye health habits, making these practices a natural part of daily life and ensuring that knowledge is passed down through generations. These four pillars work together to create a lasting impact that extends far beyond Prevention of Blindness Week, building healthier communities for years to come. By building a culture of eye care, we can change lives for generations, ensuring that children, parents, and grandparents all enjoy the gift of sight. Prevention of Blindness Week is more than just a campaign. It's a movement for sustainable change, uniting people from all walks of life in the fight against avoidable blindness. Together, these actions offer hope, restore sight, and inspire a future where no one is left in the dark. What began in India now echoes worldwide. Prevention of Blindness Week's principles, awareness, early detection, and access, are universal. It paved the way for global campaigns like World Sight Day and Vision 2020. India's model of free screening camps and community health worker training has inspired similar efforts in Africa, Southeast Asia, and Latin America. Collaboration between governments, NGOs, and communities is key to success. Today, organizations like the International Agency for the Prevention of Blindness and Orbis International work across borders to share knowledge and resources. India's annual week is a vital part of this global puzzle, reminding us that sight is a fundamental right. Through local action, we contribute to a world where no one is needlessly blind. The fight against preventable blindness is now a truly global united effort. The numbers behind vision loss are staggering. Over 1.1 billion people worldwide live with vision impairment, most of it preventable or untreated. The main culprits: uncorrected refractive errors and cataracts. Millions lack access to basic eye exams or affordable glasses. Cataracts, easily cured with surgery, still blind millions who can't access care. Most people with vision loss live in low and middle-income countries, where poverty and lack of healthcare create barriers. These statistics represent real lives: children missing school, adults unable to work, elders losing independence. The economic impact is huge, with global productivity losses in the hundreds of billions. Prevention of Blindness Week is about more than health. It's about human rights and opportunity. By addressing these numbers, we can unlock potential and transform lives. The solution is within reach if we act together. Technology is revolutionizing the fight against blindness. Artificial intelligence now helps diagnose eye diseases with remarkable accuracy, enabling mass screenings and early intervention. Telemedicine connects patients in remote areas to specialists, using portable devices to send eye images for expert review. Modern cataract surgery is safer and more effective, with faster recovery and better outcomes. New intraocular lenses can correct multiple vision problems at once. Gene therapy and smart contact lenses are on the horizon, promising breakthroughs for previously untreatable conditions. Portable diagnostic tools empower community health workers to detect problems early. These innovations make eye care more accessible and affordable. Embracing technology brings us closer to eliminating avoidable blindness. The future of sight is brighter than ever. No single group can end global blindness alone. Real progress comes from partnerships: governments, NGOs, corporations, and communities working together. The World Health Organization sets standards, while NGOs deliver care on the ground. Corporations provide funding and technology. Academic centers drive research and training. Public-private partnerships have tackled diseases like trachoma with comprehensive strategies. Collaboration multiplies impact, medicine donations, outreach, and education all working in concert. Local communities must be active partners, shaping programs to fit their needs. Prevention of Blindness Week sparks these collaborations, reminding us we're stronger together. By sharing knowledge and resources, we can bring sight to millions more. United action is the key to a world without avoidable blindness. Protecting children's vision is crucial for their development and future. Good eyesight is essential for learning, play, and growth. Many childhood vision problems, like refractive errors and amblyopia, are preventable or treatable if caught early. Regular vision screenings in schools help identify issues before they cause lasting harm. School-based programs provide screenings, glasses, and education on eye health. Teaching children, parents, and teachers about nutrition and eye safety builds lifelong habits. Investing in children's eye health unlocks their potential and shapes a brighter future. Campaigns like Prevention of Blindness Week now emphasize pediatric care and advocate for universal access. By securing children's sight today, we build a more equitable world tomorrow. Every child deserves the gift of clear vision. Ending preventable blindness is a shared responsibility. We have the tools, surgeries, treatments, and simple solutions like eyeglasses. The real challenge is access and awareness, not technology. Governments must prioritize eye health and ensure care for all. Healthcare professionals should reach vulnerable communities. Corporations and philanthropists can invest in life-changing programs. As individuals, we can care for our eyes, encourage regular exams, and spread awareness. Support organizations on the front lines, volunteer, donate, or share their message. Imagine a world where no child drops out of school for lack of glasses, and no elder loses independence to treatable blindness. This future is possible if we act together. Prevention of Blindness Week is a call to action for everyone. Let's make sight a right for all, everywhere. Together, we can turn this vision into reality.